And this morning, we're also joined live with Dr. Hawkinson from the University of Kansas Health System.
Now, he's on the phone with us right now to answer some questions about what this means for the president moving forward. Dr. Hawkinson, I guess I'll start with this. What surprises you, if anything, about this? Because we've been able to watch the president a lot. We know that his testing schedule is fairly rigorous. We know the people around him are tested fairly rigorously. What surprises you about this outcome this morning?
You know, I think anytime we find out that there's somebody, celebrity or a well-known person like, obviously like Idris Elba initially, Chris Cuomo, anytime we have somebody that's in the spotlight and has it, now especially the president, the leader of the free world who is so visible, it's always interesting to understand how did they get it, because we understand that this virus has jumped oceans, it's gone up to mountaintops. Nobody is not susceptible to this disease. Anybody can be infected by this. No matter how good of precautions you take, the virus is there, and it will seek out and it will find people who are susceptible, and it seems to have happened in this case. So it's a very good example of that. No matter how well you think you can protect yourself with bubbles and with other measures, this virus can find you.
Can we talk about, we had heard that getting a negative COVID-19 test doesn't necessarily exonerate you from having to isolate or quarantine or take those measures if you've been around somebody who's exposed. And we know that the president tested negative before the debate. We don't know when he contracted it. Can you talk about how you can test negative? Does that mean you can be exposed and maybe have the virus in you, but still test negative before you test positive?
Yeah, exactly. And a lot of it has to do with the technique of the test, who is doing the test. If it's a nasopharyngeal swab, one of those brain biopsies that we've talked about in the past, are they making sure they get to the adequate space back into the nasal cavity and the nasopharyngeal area? What is the test? I assume for the president, with all the resources he has, that those tests are probably going to be PCR tests, which are quite a bit more sensitive than the antigen test. But yeah, so for example, on the antigen test, if it's negative, is it negative because he didn't have enough concentration of virus to be picked up at that point in time? That is certainly one of the reasons you could test negative, say, for the antigen test. And again, for the PCR test, just as you had pointed out, these tests are good really for that point in time, and it doesn't really necessarily say what it's going to be like 24 hours or 48 hours from now. You probably still need to be retested. That goes exactly to the point of quarantine. So even though you're a close contact and you're in quarantine, and say you test at day 8 after exposure, that doesn't mean you can get out of quarantine. You need to fulfill that 14-day quarantine just because of that point exactly.
Do we know if you test negative and then later test positive, do we know that those people can or cannot spread the virus when they're testing negative?
We would hope, again, especially for a PCR test, that you probably don't have enough virus to be picked up. If the test was done adequately and you got an adequate sample and it was negative, that's a pretty good result that you should be negative, because they are so sensitive and specific, the PCR test. So, yeah, exactly. If you test negative for that, you really should not be infectious at that point. Now, with the antigen test, the theory is, well, if I get an adequate sample for this rapid antigen test and it is negative, then it's probably negative because I don't have a high enough viral concentration to be infectious. That is one of the theories behind the rapid antigen testing daily or every other day for people to really understand their status, so that if it's negative, well, that's okay, because it really doesn't mean that you're infectious. Again, that's more of a clinical theory that is being floated out there and some people subscribe to. So that is one of the things that I'm testing negative on the antigen. Well, that means I'm not infectious, so it's okay if it's negative. But the PCR tests are really pretty sensitive, so it should pick up even very, very small amounts of virus if you do have the infection and the replication going on.
Dr. Hawkinson from KU Health joining us this morning. Doctor, thank you so much for your time. And as always, we're going to continue checking in with you throughout this process for coronavirus. That's just the latest bit of news we've had this morning. So we appreciate your time as always. Thank you.